Dr. Justin, welcome back. This is our third conversation. Your second time on mine, and I was once on yours sharing my story.
Yes. I'm so excited you have you back, Shemaine. Very nice. Excited to chat with you,
How's things
as
in
always.
Texas today?
Doing okay. A lot of rain recently, but just trying to survive the summer heat. Doing okay. How about you? You're up in Canada, right?
The same. We've had a wet July, but it looks like August is going to be very hot, so we'll see.
Yeah. Yeah. That makes sense.
So
Cool.
today we're going to jump into a topic that is near and dear to my heart, but I know you have a lot of experience in this. That's why I asked you to
Hmm.
come back, and that is
Yeah.
SIBO, small
Yeah.
intestinal bacterial overgrowth.
Hmm.
So we hear this term thrown around a lot, but a lot of people don't fully understand what it is.
Hmm.
What is SIBO, Dr. J?
So SIBO is nothing more than a bacterial imbalance from the colon migrating up to the small intestine. And again, SIBO is this like it's a very specific term saying, hey, there's this overgrowth in the small intestine, but in the end, it doesn't really matter. I like the term dysbiosis. That just means there's an imbalance of bad bacteria in the gut. It does not necessarily matter where the location is. So with SIBO testing, they'll run and they'll give you a lactulose solution. They'll have you blow into a Quintron bag, get a baseline, give you a lactulose sugar solution that works its way down, and then they'll measure every 20 minutes um, a breath into that bag, and then they'll look at methane, hydrogen, maybe hydrogen sulfide, CO2, and then they'll look at where those levels are at different parts of that 2 to 3 hour time frame. If it's inside of the 2 hours, then the thinking is it's going to be an overgrowth of either methane or hydrogen producing bacteria, depending on which gas is elevated. If it's inside of the 2 hours, if it goes outside of 2 hours, that's normal because that's now hitting the colon, and essentially that's normal to have these spikes at 3 hours or later. So when we start to see it before 2 hours, that's where we start to assume there's a imbalance in the small intestine. And if we see it in the first, 20 minutes to 30 minutes or so, it's possible that there's an imbalance in the stomach.
Mm.
But in general, for me, I don't really need to get that nitty gritty because when you're treating bacterial imbalances, you're treating it through the mouth, so it's working its way throughout the whole intestinal tract. So you're not like injecting it in a certain spot. So whatever you do, it's going to work through its way throughout the whole tract. So you don't ever have to be that specific in the location. Does that make sense?
Yeah. So this is more
Yeah.
a dominance of bad bacteria or an overgrowth. And I just use the very layman's term of bad bacteria because most people are going
Yeah.
to in the small intestine. How would one even get something like that?
It's a great question. So we just have the term dysbiosis or an imbalance in good to bad bacteria. And then you can take that diagnosis and make it more specific by saying SIBO, right? But then what are the big causes of SIBO? So there's a handful, and a lot of them can overlap too. So first is going to be most common is just too much processed carbohydrate. You eat a lot of processed junk, acellular carbohydrate. These are flours, grains, processed sugar, anything with added sugar, added high fructose corn syrup. Bacteria and microbes love easy to digest carbohydrates. It's very simple, it's easy to digest. Also, when you have these overgrowths, it's very rare that someone just has SIBO. This is kind of the biggest myth I'll put out there is you have the right to have more than one issue going on at the same time. That's hard for most people to believe. But you can have H. pylori. You could have different types of SIBO bacteria. So in the breath testing world, it's either hydrogen or methane dominant bacteria, but we'll actually look at the bacteria on a stool test and we'll see, is it Morganella? Is it Prevotella? Is it Citrobacter? Is it Pseudomonas? Do you have H. pylori? Right. And so we'll look at the different types of bacteria, but you could have these bacteria plus H. pylori plus a parasite plus C. diff plus. So you can have an overlap. And so it's very rarely just one thing. It can be that thing,
Mhm.
but it could be an overlap. And so talked about the acellular carbohydrate. Also, when you have chronic low stomach acid, low enzymes, and we're not breaking down our food, that food can ferment and rancidify and sit in our gut a long time. And that can create problems. And so, what causes that? That can be caused by lots of stress. That can be caused by not chewing your food up well. It can also just be caused by a lot of inflammation, can also drive less stomach acid and less enzymes too. So I would say the big ones out of the gate are going to be antibiotic exposure. Oh, I didn't mention it. And then antibiotics. So antibiotics can create a rebound overgrowth as well, and that can flood the body with excess bacteria on the rebound side or excess fungus. So I'd say the big three were going to be too much processed carbohydrate and or food allergens. I'll put the antibiotics there as well. And then I'll put the chronic stress or inflammation that drives down the stomach acid enzymes. And we can even put bile in that too. Because if we don't have good bile, we're not going to break down those proteins, those fats, those carbs. And then we can have this fermentation in the gut. putrefaction, rancidification, right? Fermentation is rotting carbs, rancidification is rotting fat, and then putrefaction is rotting protein. Does that
Yeah.
make sense? Does that help?
You mentioned
Yeah.
inflammation. Can it work in the opposite direction where the large intestine or colon can get inflamed and the bacteria will be pushed backwards into the small intestine?
Definitely, especially when we see elevated calprotectin. That's a protein that's produced by the neutrophils, and that's usually going to hit the colon. And you see a lot of patients that have an autoimmune component into what's going on too. And that autoimmune issue could be an ulcerative colitis or a Crohn's issue that could impact the end of the small intestine or into the colon if it's fully ulcerative, right? And so there can be autoimmune inflammation that impacts these tissues for sure. Absolutely.
Yeah,
And
we
when you have
mentioned
inflammation, it may never be high enough to like show up on a test, but you can have mild inflammation that could be impacting these things too.
we mentioned on our last conversation about my diverticulosis and how that can
Yes.
get very inflamed, and there's potential there where you can almost get a backdraft where the bacteria
Yeah.
are getting pushed into the smaller intestine.
Yeah. And then with the diverticulosis or litis, osis is more chronic, but you just have these little haustria, they open up, and these are little outpouching herniations that food gets stuck in them. And usually a lot of inflammation, poor digestion, and then usually there's some chronic constipation going on there where we have to excess Valsalva, excess bearing down to move our stool out, and then that can kind of get those outpouchings full of food and create inflammation.
If somebody has SIBO, what are the symptoms? If we weren't testing with the liquids, what are the kind of physical symptoms that would manifest and someone would experience that would kind of tell us, hey, I think you might have some SIBO here?
So that's a great question because you have your classic symptoms where you have your methane dominant SIBO. This is where you're producing more methane bacteria or methane gases. And so you have methane dominant bacteria because of the gases. Those gases tend to create more constipation. They throw off and slow down the migrating motor complex, MMC. And then you have hydrogen dominant SIBO. These are bacteria that produce more hydrogen gas, and that can create more diarrhea. And so in the conventional medical world, they'll throw an IBS-C, irritable bowel syndrome, constipation, or an IBS-D for on the diarrhea side. And that's a diagnosis of exclusion. That means they've ruled out all the bad stuff. And so we're just going to give you this diagnosis of exclusion, just saying, hey, you have this constipation or this diarrhea issue, and we don't know what it is, but we give you this diagnosis label. So we feel like we're doing something important, but we're really not. And they just give you medications to control the symptoms. And so the symptoms, like you mentioned, you're going to have the constipation, diarrhea, and then, of course, overlapping bloating, um, acid reflux, gastritis, indigestion, that feeling of just that indigestion, that low grade nausea. These things can be at play. But then we're even more likely to have these extra intestinal symptoms. Extra intestinal means symptoms outside of the intestine. Very common brain fog, mood issues, anxiety, depression, fatigue, right? These are very, very common. If we're having any malabsorption, we could have dizziness or heart rate or heart rhythm stuff because we're not breaking down or absorbing our electrolytes too. So those are all very, very common symptoms. And it's hard for someone to connect with a symptom that's outside of the gut as being caused by the gut. And conventional medicine will never make that connection. Unless it's a strictly gut symptom, they're going to rule that out.
One thing I see a lot in clients is if there's gastric distress, there will be sleep issues because it's almost like their guts are just gurgling and churning all night, and that is interfering with their deep sleep. When we think of deep sleep, we never think of that. We think maybe it's stress, maybe it's my hormones, maybe it's blue light, but we never think, hold on, how was my stomach feeling last night going to bed, or was it upset during the night?
Well, if we're inflamed, right, that just inflammation in itself can trigger a cortisol response because cortisol is a glucocorticosteroid. The first part is glucose and blood sugar. So that stimulation can increase glucose, which can increase energy on one side. And then the corticosteroid means it's an anti-inflammatory, right? Like cortisol, like prednisone. These are corticosteroids. So the body will produce that to get the inflammation down. And so, yeah, if we have inflammation in the gut, that can screw things up too. It can impact the HPA axis. Now that feedback loop is more stimulated, so you're going to get more stimulating hormones. But also, what about the nutrients we need to sleep, right? Our sleep hormones come from protein, right? Tryptophan, converts to melatonin, which converts to serotonin. And this is protein. So if we don't have good digestion, good enzymes, good acid, good bile, we may not be able to break down those nutrients. And then that means those nutrients, that's a bottleneck of those nutrients getting to where they need to go in the brain to work and allow good, healthy sleep.
Mhm. And you mentioned the nutrient deficiencies. I had a client recently who had SIBO, and she just was experiencing chronic dizziness and vertigo. And no matter how much we replenished her electrolytes, it just wasn't improving. So clearly, the systemic inflammation was affecting her vestibular system as well. But just like loads of dizziness, and people again would never connect that to their bowels.
Correct. Yep. And when people have issues, they like a diagnostic, right? We're kind of trained like, oh, what's the diagnosis? Like this diagnosis is going to help you. And my thing is this, let's just focus on the systems of the body that aren't functioning well. Because if like the gut, the digestive system is not functioning well, then a lot of times then the immune system may not function well because that's where 80% of your immune cells. And then if there's any impact in the digestive system, that can impact all the nutrients being absorbed, and that can impact the mitochondria, the brain, that could impact cellular turnover for your muscles or skin. And so I just tell patients, let's focus on the systems that aren't working well. We don't have to give it a diagnostic label. Like if we see someone with gut issues, could there be an IBS diagnosis attached to it? Sure, that really means nothing. Could there be an IBD diagnosis? Yeah, and that means there's more of an autoimmune component, which means the diet has to be even more strictly followed. We have to reduce inflammation more. So diagnoses are helpful, but they don't totally get you to the underlying cause a lot of time. And most diagnoses end up leading into just symptom management. And I'm not anti-medicine. The problem is I'm pro root cause. And sometimes when you go to the medicine side, it's just covering up the symptoms and it ignores the root cause. So medicine's fine as long as you can pivot and get to the root cause and you're not stuck on the medicine forever, which is what most people do when it comes to Prilosec, acid blockers, right? They're just stuck on them forever. Antispasmodics, laxative, they're just stuck on it forever. And if you understand the root cause and you have a basic understanding of physiology, you're like, but that's not fixing that thing upstream. It's just managing the symptom downstream.
Yeah, which is very sad. We mentioned that on our other podcast, that getting a diagnosis for a lot of people will just paralyze them. They will just accept that as truth and there's nothing they can do about it, and that is their life going forward, which is very sad.
Yeah, and the analogy I kind of created over time is like, but if you spoke to that doctor, let's say you and that doctor who was slapping that diagnosis on you, let's say you were friendly and you jumped in his Porsche, and let's say a check engine light popped on, like you wouldn't go in as a passenger and like pull out painter's tape, be like, hey, no, I fixed it. Let's put that tape over the light. Now you can't see it. The problem solved. That's the symptom, right? You want to give me the acid reflux medication to cover my symptom. This is the same thing, right? Well, it's like, no, because that light means something in the engine is wrong. So let's fix that thing. This symptom in my stomach means something upstream is wrong, right? So it's the same thinking. We just try to get our doctors to think deeper about these things, right? That's the goal.
Yeah. So, what are we doing then about SIBO? What are your recommendations? And I can kind of throw in my 2 cents on this, but let's hear what your general recommendations for SIBO are first.
It's a great question. So first off, is it just SIBO, right? Is it just SIBO? Is there more to the story? Number two, how did it happen, right? Is this just a chronic thing where your diet was just really poor for a long time, a lot of inflammatory foods? Do you have enough enzymes? Do you have enough acid? Do you have enough bile? Do we have H. pylori? Are there other microbes at play? And then next, do we have to get stricter with our diet? Some people with SIBO, they have to really cut out even raw foods. They really have to go lower FODMAP. They have to cook the foods more. We have to work more on chewing our foods. Some people, it's like, 3 bites and they just swallow the food. It's like, no, you got to chew your food so it feels like an oatmeal-like consistency in your mouth before you swallow. Are you overly hydrating with your food? Right? All these things play a big role. Are you chronically emotionally stressed, which is putting you in a fight or flight? And then that fight or flight's lowering all your enzymes and acids. So I try to do a really good audit of what that person's body systems look like. How is everything functioning? I try to really understand the history of how this person got there. Then I try to look at, okay, what's not functioning? How can we support that? And then do we have any infection stressors that are that are holding back the healing too. And so I try to put the whole story together, and you can have more than one issue going on at the same time. What if that person also has Hashimoto's? They have adrenal dysfunction, maybe very low DHEA. Let's say they also have very low progesterone as a female,
Mm.
right? And they're not sleeping well. Well, now what do you do? Because now you started to do gut killing too soon. That's causing more gastritis. They're craving lots of die off. Now what do you do? Right? Because it's like you think this thing is it, but now the order of operations and how you start to unwind it for the patient really matters.
Yeah, for sure. There's so much. One thing that you mentioned there, and I think we did, sorry to keep repeating myself, but I think we spoke about this before, is like there's so much talk about parasite cleanses and
Hmm.
detoxes right now. Probably
Hmm.
like here in Canada is camping season and everybody wants to do a parasite cleanse. And someone asked me about this the other day, and I was like, first, if you were going to do it, you wouldn't do it in the middle of camping season. That's a complete waste of
Right.
time. Like wait till
Right.
fall or something. I'm like, but it's not as simple as what people think it is. Like, you do a parasite cleanse, you could be opening Pandora's box. The die-off symptoms can be pretty harsh. That can affect your thyroid, your hormonal system. It's not just take this pill and all parasites are going to leave your body. Like, it's so much more complicated, and you really can open Pandora's box.
Yeah, I mean, I tell patients it's like taking a sedentary person and putting them through a Murph CrossFit workout on day one. It's like, well, you probably need to work up to that. There probably needs to be an on ramp where you get a person ready for that. And it's the same thing when we deal with any kind of infection. And I put infections, put bacteria, parasites, and just be open. You may not have a parasite, but you could have other microbes that could be creating similar symptoms. So it doesn't really matter. Just be open to it. Just don't even label what you think you have. Just say, hey, I'm open to looking at gut stressors, gut bugs in general. That way you're open to it.
So let me tell you my little story. Well, as you know, I have diverticulosis. So
Yeah.
back in January, my birthday, I picked up some weird stomach flu, and not to be too graphic, Dr. J, but
Hmm.
it was coming out both ends for a good 12 hours. I was not in a good place. I don't know
Could be a
what.
virus.
It
Hmm.
was so bad, and I
Yeah.
was so sick. So then my body got super inflamed. But by the time the inflammation calmed down, I started getting this pain to the left of my belly button. So to the left,
Yeah.
and a tiny bit down. So I'm, of course, searching pancreatitis. Oh my God, I've got pancreas cancer. I'm gonna die. You know the worst, Dr. Google.
Yeah. That's a little bit low. That's too low for pancreas, but yeah.
So, anyway, managed to connect the dots. I did a SIBO test and it turned out it was SIBO. I I knew that if I wasn't going to do antibiotics, which it's not me, I don't take
Right.
antibiotics, and I know there are instances where antibiotics are essential, but it wasn't something I wanted to do. So I knew, well, if I take a natural approach to this, it's going to take longer than the antibiotics. So I was prepared, obviously, with what I do to invest a few months in doing this properly. So I was already taking berberine, so I just had to really I brought in some neem, which was a
Yep.
game changer.
Yep. Neem's
With
great.
neem immediately stopped the diarrhea.
Yeah. Neem's
Like
great.
on the spot. And when I ran out of the first bottle, for those 2 days where I was waiting for more, the diarrhea came back. So I knew I hadn't done all the work. So I'm taking berberine, I'm taking neem, oil of oregano, and extra strength garlic. It was doing the job, but I needed a bit more help. So then
Yeah.
I don't know if you've heard of Kenyan. You should reach out to them. They're awesome. So they sent me one of their red lights. So I was doing that. It's targeted red light therapy. That
Mm.
helped a lot with the pain. Um, but the one thing that kind of final nail in the coffin was I had to go low FODMAP. Even now, if
Yeah.
I have to, even apples right now can cause pain in that specific area. It feels like a
Yeah.
ball of gas, and it's actually quite painful. Now, nothing compared to what it was in February and March, but it's so interesting. You have to become so aware of everything that you're doing. But yeah, the diet
Correct.
change, my diet's good regardless, and I do miss my apples, but I've noticed the higher fiber can aggravate it, which is interesting.
Yeah, and sometimes with people like that, we'll even just do a bone broth fast, zero fiber for just a day or two, just to kind of give everything a rest, put no stress in the body, zero fiber. And then we'll even move to a carnivore diet for a couple of days to a week, just zero fiber. Because a carnivore diet is essentially an autoimmune low FODMAP diet, right?
Mhm.
So when we say low FODMAP, we're saying, hey, here these are carbs, but they're also low FODMAP. And then we'll work on adding in low FODMAP carbs cooked, right? Cooked, steamed, sautéed, or Instapotted, and then we'll add things back in. I mean, I like carbohydrates, especially veggies and some starches if you can tolerate it, right? If, as long as it's cooked, because there's a lot of micronutrients in there. But if you can't, we'll just start with that leg first, and that kind of provides a lot more stability. And in your situation, it seems like there's got to be something more acute because just a SIBO thing, to have it that severe, there had to have been some kind of either a transient, like adenovirus or like stomach virus or something else going on there because that's pretty severe when it happens at that degree.
Yeah, it was like I have a good pain tolerance. It was pretty painful where I thought I was
Yeah,
dying. It's subsided now, but once in a while it comes back and I don't eat I don't eat bad, but I do need my carbs to perform on any level, so I have to be really
correct.
smart with what I'm doing. But I do good with green beans. They're easy to digest, and berries pretty good.
Bingo.
Um, I'll do dates, not every day, but every few
Hmm.
days to get that kind of fast sugar hit. But otherwise it's been quite an experience. We something I mention a lot, not just with you, with everyone, like as practitioners, our mess really does become our message. We're given these almost gifts of poor health so that we can learn from them, so that we can tell other people, hey, this is what helped me, it might help you.
Yeah, I believe God always puts challenges in your life, and then I try to look at it and really analyze it. Like, what happened here? How did that? Okay, let me try to really understand. Let me dissect that. Like, I think this is a really good teachable moment and try to really understand it so I can make a video on it or bring it to light. Because it's like if someone can hear it, then they can benefit too.
I also think though, because my the diarrhea was so bad until I brought in the neem. And I think that played a big part in my absorption of nutrients as well, because within a few weeks, then I saw major changes in body composition too. The weight,
Yeah.
like body extra body fat started falling off. I started building muscle faster, easier. So it's really interesting the way it's all so intertwined and works synergistically, but obviously the average person would not think of this sort of stuff.
Yeah, and also too, when I see extreme diarrhea, you really got to be on top of the electrolytes and hydration. And I'll do bismuth salts throughout the day because bismuth will take whatever is irritating your colon or your small intestine and it blocks the mucosa in the small intestine or colon from being bound by that bacteria. And so it prevents that bacteria from binding into the mucosa, which then when that happens, your body floods water in to flush it out. And so the problem is then you don't absorb stuff, you get low electrolytes, you get dehydrated. So I'll use bismuth salts to block the mucosa from being irritated by the bacteria. And then we'll give binders in
Mhm.
and around meals to then soak up that debris so then we can pull that debris out safely without having to utilize more dehydration slash diarrhea to get it out.
Yeah, that I forgot about the binders. One thing that makes me feel good, like makes my guts feel good, is
Mm.
activated charcoal. Probably because it's
Yep.
binding.
It's
I can
binding up some
feel the
stuff. Yeah.
difference. So
Yep. Binding up that. Yeah. It's helpful.
you mentioned that there can be other things at play. There can be lots of other things at play. But what about fungal intestinal overgrowth? How common are they?
All the time. Like I tell patients, you have the right to have more than one issue. I see a lot of times these things stack. So we'll see on like a GI map test or a stool test, we may see a low level of candida on there that may not be flagged, but it's there at a lower level. That's usually a problem. On the organic acid test, that's where we're really going to see it, whether it's tartaric acid or diarabinose or 3-oxyglutaric. You're going to see these organic acids elevate when there's candida. And sometimes you can even see colonized mold in the gut. Some of the fusarium or aspergillus markers on the organics show up positive too. And then you have a colonized mold factory in your gut. And then we want to look at, mold in your environment too, make sure that's a thing. But yeah, that's super common. It's really common. And again, even if I don't see it in the gut, if I see potential symptoms, chronic nail fungus is unique because you could get it if there's more walking around barefoot, too much sandals in the summer without cleaning them, locker room stuff. So you can get that, and it may not be a gut thing. But if we start to see fungus in your skin, tinea versicolor, that kind of white, looks like almost like a vitiligo type of skin issue, or we see it in the hair, right? Or we have chronic, vaginal yeast issues, right? Any of those things, we're like, all right, there could be a problem here. Or thrush, white coated tongue in the mouth. These are all patented signs of fungus.
And you can have both at the same time.
You can have all of it, and then you can have H. pylori too. You can have everything. And so most patients, they watch a video, and us content creators, we make a video on a topic because people search a topic, right? So you have to put like an umbrella out there, like this topic, but then within that topic, you have to always be open to you can have this and a bunch of other stuff. So just be open. People listening, just don't glom onto one thing. Be open to all things that could be there.
Oh yeah. And it's so easy to get these things. I would argue maybe more now than ever because we have the higher amounts of stress. We're suppressing how our body is supposed to normally function. It
Yes.
bacteria, stomach acid, the immune capacity, all that. So these are you're at higher risk now than say let's in the 1950s and 60s.
Correct. And I just saw a patient, or I saw, someone just earlier today where they talked about going after and killing microbes right away. And I didn't say anything, but I'm like, that's a bad idea. I've been at this show 5,000 plus patients in 15 years. I've done this a lot of times. If someone's really healthy and has a really acute issue, right? Like their health has been great, 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 great. And they got a stomach bug traveling to Mexico, drinking the water. Okay. You can handle those things like that, right? But if this is more of a chronic issue where most people's issues are chronic, you got to be very careful on how you handle things, right?
Yeah, that was my
Really
argument.
important.
Yeah, that was
Yeah.
my argument with the lady the other day. Like, and she wanted to do a parasite cleanse on her kids. I'm like, I don't know if that's such a great idea because
Yeah.
you could be opening yourself to a whole host
Yeah.
of issues. And really, like what you're saying, if it is something acute where you drank water in Mexico and you ended up with chronic diarrhea. That's an acute thing. Maybe take
Yes.
some activated charcoal, some electrolytes. But if your body is healthy enough, it's going to deal with that. Like at the
Yeah.
baseline, what we're saying is if your body is healthy and you're supporting your body, it's going to be able to deal with a lot of this stuff by itself.
Correct. And I like to be specific with my words, so I'll just call it a microbial cleanse. I'll just use some of my clearing herbs, and I'll do a cleanse for 30 days to 60 days, once a year typically. I'll go into it with no symptoms, meaning I don't have any issues. I'm just doing it more for like spring cleaning out my gut and just really be on top of probiotics. And I'll have no issues. I'll have no die off at all. But most people that I see, they're coming in with a lot of issues and complaints. And that's where just coming in there and doing gut killing, especially when there's a chronic history to it, you got to be careful.
What are the herbs that you like to use?
So when I reformulated my GI Clear 4, I custom manufactured that. So I picked out all the herbs and I looked at all the formulas I've used over the years. And so I added neem. Neem was wonderful. I love neem. Very high golden seal is wonderful. Golden seal is considered an herbal antibiotic. I'll do golden seal. I'll gargle with it at first sign of a sore throat. So I love golden seal. Also, olive leaf is great too. Olive leaf is absolutely wonderful too. Um, Burdock root is great for the lymphatic. And so this is really helpful for die off because the lymph can get very congested. And so burdock root is also very helpful.
Mhm.
Straight berberine, very high dose berberine can be very good too. So I love berberine. Also, there's synergy. If you look at any of Stephen Buhner's work, he talked about the synergy between wormwood and berberine. There's some synergy there of those herbs working together. So I love that one there as well. That's another great one. And I think I hit all the big ones there. And then I also do like a little bit of bismuth. Bismuth can be wonderful for bacterial issues too. So I like that as well. There's a handful of other ones, but those are some good core ones out of the gate. And then sometimes utilizing biofilm busters too. And so we'll throw in ginger, higher dose ginger, or even N-acetylcysteine, which are really good mucolytics. So they'll break down that mucus biofilm, which allow the herbs to actually work better too.
Mhm. I I drink burdock tea once in a while for kidney support. It's the
Yeah.
most horrible tea you can ever drink, but I still drink it.
Yeah. If you remember that It's I got to be careful what I say here because I don't, the sensors are out there. But it's a condition that impacts your immune system. It's a special tea called SEAC-T. And SEAC-T is for use for immunological issues. And so the main ingredient in that tea, SEAC-T, is burdock. And so very good for the lymphatics.
This just popped into my head. I've been taking berberine for years, as long as I can remember. Do you think someone can adapt to berberine where you hit like a tolerance where it no longer works for you as well anymore?
I would think so, and that's where I'm really have a lot of trepidation because berberine is used for it can be used as a natural GLP-1 agonist, kind of like Ozempic or Mounjaro or any of those medications. So there is an impact like that. Obviously, not to that degree. It can impact the lipids. It can positively help with the lipids. Some people have very high cholesterol. Like I think cholesterol is not a problem, but if someone's in that hypercholesterolemic where they're well above 300, you may want to do something to naturally lower it. Some people want to avoid statins, and which is good because statins can impact the mevalonic acid pathway and lower CoQ10 and create a lot of muscle problems. And so berberine can be helpful, right? For that reason. But I do worry about it impacting the gut microbiome over the long haul, right? I do worry about that. So I like to use it sparingly and intermittently. But berberine's great for blood sugar. It's natural GLP-1. There's a lot of good benefits with it for sure.
I wonder if rotating, like if you were using it for blood sugars, if rotating berberine 1 month and then bitter melon the next month and just rotating might be a better idea to prevent
Yeah.
adaptation.
I just worry about things coming in that are going to negatively impact the microbiome because even though things like berberine, they knock out bad microbes, but they can also impact the beneficial bacteria. So I worry about that. And so when I deal with like blood sugar, I'm always like, all right, let's focus on nutrients first, right? Magnesium, B vitamins, chromium, those kind of things. Let's use non-antimicrobial herbs second. So that's going to be cinnamon, gymnema, bitter melon. So herbs that help with blood sugar, but aren't necessarily antimicrobial.
Hmm. Are you
But I try to always do
primarily
nutrients first.
are you primarily using capsules, pills? I was just thinking I have Gynema tea as well, and that is terrible.
Yeah, you got to use capsules for some of those things. Cinnamon, you can, just get a really good clean cinnamon, put that on a Granny Smith apple. That's wonderful. I love that as my treat. But cinnamon's great. And then you have your core nutrients, magnesium, wonderful for blood sugar. And then chromium as well. Very good. Alpha lipoic acid too. Very good.
The company Four Sigmatic that make the mushroom coffees.
Yeah. Yep.
Absolutely, like I'm addicted to that coffee. So that's my one coffee in the morning, and I put in like a heap of Ceylon cinnamon and ginger.
Yep.
Incredible. Like it's my favorite thing.
Yeah. And I look at the coffee, the amount of mushroom, like normally you get in like one capsule, you get like 500 milligrams or so of a mushroom in one capsule. The typical serving of one of those coffees is like less than 100. So I always tell patients that's good, right? But you can also just take your coffee and take a mushroom extract too, like a cordyceps or a lion's mane or a reishi, and then you can get the benefit that way too.
I just really like the taste of it. A lot of people don't, but I really like the taste of it. I'm just,
They,
this
they
is
blend it really well. Mhm.
Yeah, this is just a random question that just popped in. People have asked me this before and I've considered it. What do you think about taking too many capsules and overloading the liver? Do you think that's even a thing? Because sometimes I think it's not. The liver is designed to break down and transport these nutrients. But at the same time, I'm like, well, if you're taking 50 capsules a day, that might be a concern.
It depends what's in there. People say that well, anything you put in your body goes into your stomach, it gets absorbed and it goes through the hepatic portal vein. So everything, unless you're like doing something transdermal or injecting it, everything goes to the liver. And then the question is there toxins in there that are going to impact it? Because if it's just nutrients, it's all going to get mixed around and become chyme with all the other food, and it's all going to get mixed in there together. And so it's not like there's just all these pills going in separately. It all just gets mixed in with the chyme and it's a bunch of slop that all goes together through it. And so as long as it's clean and any of the capsule stuff's all going to be cellulose based and very well broken down, I typically am not too concerned about it. As long as the quality of what you're taking in is good.
Yeah, that's what I was thinking, especially if it's cellulose or hypobromulose, like they're technically fibers. It shouldn't be too concerning.
And they break down really easy, So I'm not too worried about it. I mean, when I work with patients who are sensitive, I just start out with enzymes and acids. Like we're just starting out with just getting digestion and motility fixed first. And so when we add things in, we're always getting better over time, very, very much worse. We're very much avoiding getting worse. But if we do, then we're not going to continue to stack in more supplements. We're going to just focus on the foundations, get stability first, and then we can go up. And so typically, patients, if we're adding in more things, they're doing better, not worse. And if they're doing worse, then we're just staying at the foundations till we figure out what that issue is.
Let's discuss acid reflux before we start to wrap up. Acid reflux
Yeah.
is a huge problem.
Oh,
Huge.
yeah.
Twice recently, I got connected by two moms. They're teenagers, one 16 and one 17, had been told to start proton pump inhibitors. And I'm like, are
So
you
bad.
crazy? That's insane. But
So
there's,
bad.
yeah, so I'll let you go. Like,
Yeah. Any specific question, or do you want me to just hit the area, kind
just
of
like,
generally
let's
speaking?
explain what's happening with acid reflux, and the causes, and really helping people understand. And I'll give my 2 cents on what I see happening with my clients too.
Yeah. So I try to look at anytime I look at something, right? Any issue, I try to understand like what's normal physiology. Because if you start with what's normal physiology, how does that work? What's happening in the body? And if you start there and then you say, okay, now, when someone has these symptoms, what starts to dysfunction in that physiological chain? If you can start with what's normal, right? And then you, because if someone gave you like, here's a liver, right? It looks normal, or here are some lungs and look normal. And then you saw a smoker's lungs, you'd be like, oh, I see the difference. This is night and day. So I try to take that same mindset when we look at anything in the body is what's normal physiology and function. So first off, you eat food, you chew it up, mastication, right? You start to get amylase and enzymes from the saliva. It starts to break down the food. Chewing the food creates more surface area, so it allows the enzymes and the acids to work better. It can hit it from more angles, okay? When that food comes in, you have this gastrin production, which then produces stomach acid. That stomach acid and that gastrin closes the esophageal sphincter. That food starts to break down. It gets mixed up. It's called chyme, right? All that mixed up slop is chyme. And then eventually that pH is nice and low, right? So that pH activates proteolytic enzymes. It turns pepsinage into pepsin. And that food is now going to go from a nice acidity into the small intestine. That nice acidity triggers cholecystokinin, which is a peptide that stimulates the gallbladder to contract. It also causes the pancreas to make lipase and amylase, and proteases, chymotrypsin, trypsin, that break down protein, fat, and carbs. Now, what starts to happen in that cascade is if we have inflammation or we have stress, we start to lessen the gastrin, we lessen the stomach acid. That esophageal sphincter stays a little bit more open, and now food, instead of being broken down, it starts fermenting in the gut. That pH is a little bit higher, and then now food can rise up and ferment and create irritation at the lower esophageal area because that sphincter is not closed. And then also the upper esophageal sphincter can even stay a little bit open where it could even hit your throat, and you can get some LPR and silent reflux too. And so you can have both of those sides. Usually more LPR, it's going to be more irritation in the throat, maybe more mucus coming up, where lower esophageal is more of that, like that burning, that heartburn, that pain that's more lower. And so you can have both of those issues because depending on what sphincter is open or not. And then also, if you don't digest your food, you could also have an overlay of gastroparesis where the food sits in your stomach longer. And this is a big deal because if you take a bunch of acid, thinking, oh, I'm going to help it, but then you're lying down 2, 3 hours later, that food may still be in your stomach, and that esophageal sphincter is a little open, and now you're using gravity to bring it up when you're laying down. And that can create silent reflux too. And you can wake up in the morning really irritated from that too. And so you have to understand the physiology and understand what's driving it and when. If someone's telling you they're waking up with a lot of issues, then we got to work on the gastroparesis, the emptying. We may eat further away from bedtime. We may do less acid at bedtime too, and just try to do easier to digest things so we don't have that acidity in there. And we may give more prokinetics to move the food through. If it's more after a meal during the day, then that tells me something else. And that's where adding in more enzymes or acids can be helpful. But some people, they have gastritis too, so they can't tolerate the acid. And so you have this double-edged sword of like, well, the acid makes me feel worse, but I need it. And so then it's like, well, why? What is that telling you? And that tells me that there's gastritis and there's a weakening of that gut lining. Conventional medicine typically just gives you an acid blocker or an antihistamine like a Pepcid AC and maybe a Gaviscon coating agent. But doesn't fix it. And so that's where we have to be really careful. And maybe we don't give acid. Maybe we're giving more nutrients to heal the gut lining. Maybe we're doing diet changes that are very easy to digest. Maybe more soups and stews and Instapot. Maybe we're doing more bitters. And so this is really where these are the patients that are the hardest and the most sensitive. All right. So we have to really dial everything in perfectly there. But I just kind of gave you a couple more scenarios there. But any questions on that where I can go deeper?
Well, I think we need to mention like age is a factor and low thyroid
Yes.
function. As people get older, we naturally start to produce less enzymes and acids. But also, if thyroid is an issue, well, that just slows down everything, including production and digestion processes.
Yes, so you naturally make less enzymes and acid as you age. It's part of the why seniors just like you see, like if seniors aren't on point, their thirst mechanism tends to go away. They tend to have low electrolytes, and then they start to have heart rhythm issues because their electrolytes and hydration stink. And then they don't make enough enzymes and acid, and they undereat protein. They start losing half their taste buds. As you get older, go from 10,000 to 5,000. Then you undereat protein, and you don't break it down, and then you start to shrivel up. You can literally see seniors shrivel up due to their lack of either activity, protein, or nutrients. And so I see it. It's very sad. And so that low enzyme, low acid, and just really being on point with getting enough protein is very important, especially as you age. Or if you have a lot of chronic stress in your life, that's going to lower enzymes and acid. I mean, I think of the commercial from the 80s where like the guy comes home from work and back then he grabbed the Alka-Seltzer and put it in the water and he's like, and took it because everyone kind of knew like work and stress tend to come with acid reflux because that emotional impact on the HP axis impacting and lowering enzymes and acids is a real thing too.
Back in Ireland, when I was growing up, we had this ad, and it was more like cheap AI back then. But
Yeah.
it was for a product called Rennie, and then they had like Rennie Rappies. It was like our version of Tums, and you
Yes.
see the graphic. It was like an AI cartoon, crappy
Yeah.
graphic, and they would take the Rennie, and then you would just see it going through the digestive system. But originally the stomach and the esophagus would be red, but as soon as they take the Rennie, it would go blue, like it was just cooling everything down.
Exactly.
And if
Exactly.
people can like YouTube that or search it, I think it's so helpful because it covers what exactly proton pumps and Tums and Rennie they're doing. They're masking, they're covering the issue, but they're not fixing the issue. And unbeknownst to a lot of people, underneath this mask or this cloak, the issue's getting worse and worse and worse. You're not doing yourself any favors taking these things.
100%. And things like Tums, right? I'm just looking it up right now. Tums ingredients. It's usually a calcium carbonate, which is like a sidewalk chalk, which is like very more alkaline. And so that will kind of bring the stomach acid up. Okay. So usually, and then some will even have some aluminum in it too, which you got to be really, really careful with. Some will have aluminum, some will have cornstarch and other junk in it. Some will have dyes too, the yellow dyes, all that junk. And so that's the thing. And then you have the proton pump inhibitors. That's the omeprazole or the Nexium. Guess what? Their study meta-analysis last fall that came out that it puts a lot of stress on your kidneys. That it can, if you already have kidney failure, it can negatively impact it. But we know it's a stressor on the kidneys, and that's a proton is hydrogen, right? So there's hydrogen coming out, and then essentially you have things like sea salt and zinc that are important, and that hydrogen bonds to the chloride, and then you make HCl, right? And so that's blocking that. And then you have Pepsid AC, because part of the histamine response is you actually can stimulate acid production via histamine in the stomach too. And like Pepsid AC is a H2 blocker, and that will basically lower stomach acid as well via an antihistamine. So those are your big three mechanisms, right? You have your calcium carbonate, you have your proton pump inhibitor for the most part, and then you're going to have your antihistamine. Those are
There's
your big
a lot
three.
of there's a lot of other side effects to PPIs that people are not aware of. Like it can destroy the gastric health even more. It can contribute to headaches, migraines, that electrolyte imbalances. They're not just like safe. They're not fine to take. There are better alternatives.
Well, it's not fixing the underlying issue. Anytime you screw up digestion and absorption, that can throw off motility. And then also everything you need in the body from a function standpoint, your brain, neurological health, memory, energy, focus, they all run on nutrients, right? Whether it's amino acids, fatty acids, carbohydrates, micronutrients, those all have to be broken down, absorbed, assimilated, and utilized. And so if we don't have those enzymes and acids. And remember, we start the domino rally of digestion with acidity. Acidity lowers the pH. pH lower, you activate your proteolytic enzymes, and then that starts to trigger healthy bile function. When you start to raise your pH, normal pH is around 2, and then you go 2 to 3 or 2 to 4, pH, it's not, you're just off by 1. Every pH you go up from 2 to 3, it's logarithmic, it's 10x. So if you go 2 to 3, you lowered your pH 10x. If you went 2 to 4, 100x. 2 to 5, 1000x. And so it's logarithmic. And so when you lower that pH, it drastically impacts your ability to absorb nutrition. Not to mention that the nice low pH makes it hard for microbes to grow, right? So pH is very antimicrobial. It's why like my cleaner that I use on my countertop is a diluted white vinegar, right? I dilute it half and half with RO water and I wipe down and it takes the grease and kills the microbes because the pH, that nice low pH vinegar is acetic acid, okay? And so that acid is antimicrobial, but that acid has an antimicrobial impact in your stomach too, that natural acid. So it allows more microbes to start to grow.
Mhm.
But women see it too when women take birth control pills for too long, and that can shift the vaginal pH and make it more alkaline, and that can start to make them more prone to fungal overgrowth. We see it in other areas too.
Yeah, for sure. What as we start to wrap up now, what are some triggers
Yeah.
that you see for acid reflux? I see alcohol. I
Yes.
see vegetable oils are a big thing, especially salad dressing, Dr. J, believe it or not. I have one client, and every time she gets exposed to what I call a crappy salad dressing, she's like, "Oh, Shemaine, my stomach." I'm like, "I told you." And also,
Yeah.
another thing that drives me nuts is these alkaline waters. I'm like, "You guys are crazy. Your body should
Hmm.
not be messing with the pH like that."
Yeah, there's two ways to mess with the pH with water. So first off is water just with enhanced electrolytes, right? If it's like just over 7, that's fine, right? If water gets really alkaline, maybe they added a bunch of magnesium and a bunch of potassium, but it just depends, right? You got to be careful going too alkaline right before a meal. So if you're drinking water that's 8 or 9, no. Most water that's extremely pH driven is usually by hydrolysis. Like you'll see some of the Kangen machines, they'll split hydrogen ions to raise the pH. That's more of an unnatural thing. But if it's just via electrolytes at a normal level, what's that mean? A pinch of sea salt in your water probably gets your water to like around a 2 to 300 on a TDS meter, right? At a level where you can't really taste it, it's going to be fine. It's going to be like 7.1. It won't be a big deal. It's when you go extremely high. And then your other question was,
Just some food triggers that you notice.
yes. So you mentioned the female patient with the salad dressing, right? That's going to guarantee it be soy or canola oil. Those are big food allergens. Plus, canola oil is just nasty stuff. Go on YouTube and type in how is canola oil is made. It's disgusting. So stay away from canola oil. Gluten, right? It's going to be a big one.
Yeah.
Alcohol can be. I mean, it depends on the alcohol. There's alcohol like where you're doing some clean vodka, but if that irritates it, that's just a sign that you probably already have some gastritis. But alcohol can be hard on your stomach. But if it's an irritant and it's clean alcohol, it's probably just revealing that your stomach is mildly irritated for sure. That's why if you're going to have some alcohol, right, keep it clean. Tito's vodka, something clean. I mix some kombucha in mine and I put some mineral water in it and I will have some protein in my stomach first. So I always have protein first. That way, if it comes in, it's not up against the mucosa. But again, if you're dealing with active acid reflux, probably put any of that stuff to the side before you get under control first. Gluten, of course, is the big one. Dairy can be a big one. Gluten's a big one. Gluten really can cause a lot of problems. Yep. And then I would say
What
dairy,
about
anything that's going to be
people?
more processed.
What about what about people that have issues with tomatoes and tomato sauce? I'm thinking specifically my sister, but I know this is not uncommon.
Yeah, it's definitely possible. I mean, that's why if someone has chronic acid reflux, and they have also a lot of bloating issues, we'll look at going low FODMAP and going low IP, just AIP, because tomatoes sometimes can be a problem. Sometimes nuts and seeds and eggs can be a problem. And you're like,
Yeah.
crap, I didn't know. So when I get really, I look at the history, right? Because I don't like to make a lot of changes unless someone really needs it based on their history. Then I'll go more strict. And that's, it's important to have those tools in your tool belt as a clinician because, yeah, sometimes that can cause it for sure.
Just two tips before we wrap up, Dr. J. One,
Yeah.
I'm a sucker for a good margarita. My argument
Yeah.
is the lime is stimulating digestion, and then
Yeah.
I'm getting
Sure.
the polyphenols from the tequila. So I'm just like,
Sure.
let's just leave that. Don't burst my bubble. And
Oh no. So yeah. So when you do your margarita, right? Half a lime squeeze, get like a nice sparkling mineral water, and then a really good tequila. That's great. Or my patented Dr. J's Moscow Mule, half a lime, some sparkling mineral water, and then I'll do the other half will be ginger kombucha.
yeah, there's a
That's it.
great ginger
And
beer you can get here that's made by a Remedy. They're a kombucha company. Delicious. 5 calories, low carb, really good.
that's good. Yeah, a lot of them are really high sugar. You look at like some of the big ones like Crispin or those, it's like 20, 30 grams of sugar. So yeah, try to keep the sugar down. And then worst case, you can always have a little activated charcoal, a little NaC and vitamin C and call it a day. And that's usually pretty good. If you wanted to drink and protect your tummy too.
My last tip, just for people listening, Dr. J mentioned that eating too late in the evening or close to bed can be a big trigger, not just for acid reflux, but for causing damage in the stomach. And one thing I'll do is if I know I have to go to an event or I'm eating later in the day, this is me, but someone might find it helpful. I will take up to 20 digestive enzymes to make sure that that food is digested by the time I get to bed.
Yeah, and people that have healthy gut function, they're going to have a tight esophageal sphincter and it's going to close up. And even if they're horizontal, it's probably not going to come up. But if you have a weakened esophageal sphincter, that's where you get a 15-degree wedge pillow. Go Amazon, 15-degree wedge pillow. That'll give you just enough gravity to work in your favor to keep the food down. Try to give it a couple of hours. And then sip on some ginger tea later after a meal, maybe 2 hours later, because that's a natural prokinetic, natural stimulant to release the food from your stomach down the intestinal tract. And so those are kind of my big tips. And then, try not to have a really big heavy meal. Or if you do, try to give it 4 hours, and try to go higher on the enzymes to break it down and try not to, eat a lot of heavy stuff, right? Because you want that food to move from the stomach into the small intestine, then you're pretty good. And then, it's good to have a wedge pillow. If that happens where you don't do it, then you can at least abate it by doing that.
Well, Dr. J, another fantastic conversation. I'm going to pop all your links down. You have your new thyroid
Great.
book out, and you work with people all over the world. But if there's any guys there who's listening to us who would specifically like to work with a man and not a woman,
Yeah.
totally reach out to Dr. J. He works with people all over the world.
I see patients that come in, on the male side, we see a lot of low testosterone, low libido, hair loss. I mean, of course, all of the other gut issues, fatigue, brain fog, all that. So we can look at all of it. And again, my new book is out, thyroidreboot.com. That'll redirect to Amazon, but that hit #1 preventative medicine. So I'm really pumped about that. Yeah, great book. And then again, my book, even though it talks about thyroid, it connects everything back to it. And so it's going to be a very holistic take on thyroid health.
Yeah, it's all connected. Well, thank you for your time again, Dr. J. A pleasure as always.
Oh, yeah. And I see patients worldwide. So if anyone needs help and support, justinhealth.com, there's a link there. You can go to my site and there's podcasts and YouTube videos. I do a lot of live content. And if you want to reach out there, you can get a hold of me. And I'm happy to, see if you're a good fit and work with patients worldwide. So if that's an option, it's there for you.
Yeah, I'll pop it below. And Dr. J's YouTube channel is a gold mine. So go subscribe, check that out.
Awesome.
All right.
Awesome.
Thanks,
Thanks so much,
Dr.
man. I really
J.
appreciate
This
it.
is great.
Thank you.